Hey, Rollin, are we ready to go? You want me to go ahead and get started?
Yep, let's do it. Yep.
All righty. Good morning, everybody. This is Max Smith with 501c Services. I'm the Communications Director. Rollin, if you could go ahead and go to the first slide for me. Today's webinar is the future of benefits in the nonprofit sector. We appreciate everybody for attending today. As you all are well aware, at 501c Services, we're a 100% employee-owned company. We provide alternatives to state-run unemployment insurance programs through several of the programs you see listed. 501c Agencies Trust, which has more than 1,500 nonprofit members. The Boy Scouts Unemployment Plan. You Insure, which is a first dollar unemployment insurance program. And our HR Services, which serves more than 2,000 for-profit and nonprofit organizations across the country. Many of you on today's program already work with us, and we appreciate that. And we hope you continue to do so. Go on to the next slide, guys. A little bit of housekeeping before I turn the program over to Rollin at the Schuster Group. If you have any questions, you should feel free to shoot those to us as we go. We will hold most of the questions to the end, but we will interrupt Rollin as we go in certain break points to go ahead and answer any questions as we go. So if you have a question, shoot it in there while it's fresh, and we'll get it answered as quickly as possible. The materials for today's program, the handouts, the copies of the slides can already be found in the handouts section of the GoToWebinar platform. You go to handouts, click the down button, and then you'll see it. You can download a PDF of today's slides right now, and also I'll email those to you later today, about an hour after the program, if you want a copy of the slide deck. Of course, today's program is worth recertification credits for our human resources friends on the call, HRCI and SHRM, 1 hour of each. You know how the drill for that. You have to complete the post-event poll to let me know that you need those credits. When we conclude the session, the poll will pop up immediately, and you can fill it out right then. If you need to jet for lunch or for a meeting, a link to the poll will also be included in the post-event email that will go out later today, so you can do it later today if you can't do it right after the program. Also, Rollin is going to be referencing a couple of surveys today, some data from Kaiser or Metlife. If you need copies of those reports, you can just shoot Rollin an email, and he'll be happy to share those with you. All right, I'm going to go ahead and introduce our friend at the Schuster Group, Rollin Schuster. Schuster Group is a financial services firm, and Rollin is the managing principal. He's also the founder of an organization called the Alliance for Nonprofit Growth and Opportunity, or otherwise known as TANGO. TANGO provides professional services and mission support for about 1,400 nonprofits now, and we're happy to say that 501c Services is a proud partner of TANGO. And having done all that, Rollin, you ready to roll?
Ready to roll, Mac.
All righty, she's all yours, man.
Okay. First of all, Mac, thank you. It's great to be with all of you today. 501c is one of our wonderful TANGO partners, and it's an honor to be sharing some thoughts with you today. So as we go through this, anyone is welcome to post questions as we go through the presentation. I'll do my best to answer them as we go along. We can also spend some time at the end, time permitting, to tackle some questions too. So I wish I could see all of you. Most of our work is seminar based, where you can actually see the audience and have dialogue with. We do far more of those live events than we do webinars, but great to be with all of you. So quick introduction on our firm. We have become one of New England's largest nonprofit-focused employee benefit advisory firms. We've been around for 27 years. We've had consistent growth of all those 27 years. We like to kind of capture that in a saying we have called professionalism with passion. We think we are genuinely different. We're told we're different, really because of our very, very focused efforts and work and success in helping nonprofits expand their footprint and manage a lot of the employee benefit and insurance-related issues. We really have three practices within our company: health and welfare, which is a very vibrant, innovative practice. We think we're on the forefront of a lot of the change. We sit on lots of committees, both regionally and nationally, as we explore solutions to healthcare. Retirement, we do a great deal of work in the retirement plan space as well. We've got almost $2 billion under management in our office. The vast majority of those assets are within nonprofit 403B and 401k plans. We have a property casualty division called IPG. You can see the logo on the platform here. And then mostly I'm proud that we have created our own nonprofit called TANGO, and Max spoke of that. And we're really doing some great work with TANGO, and I'll get into that on the next slide, Rob. So TANGO really has become a community of nonprofits and socially conscious businesses working together to build capacity and really create positive change within the sector. Think of it as a partnership between the for-profit world and the nonprofit world. There are a lot of organizations that, like us, have a philosophical alignment to blending their work with sort of a greater purpose under the auspices of doing well by doing good. And for the last 12 years, we've focused on building this TANGO platform, and we now have 1,400 nonprofits that have joined us. That represents about 160,000 people that have chosen to work in the sector. And it gives us enormous clout as we go out to the market and start to initiate positive change. We've hit that tipping point where we're really starting to see results. And again, it's great to have 501c as a partner. They're doing some great work for the sector, as many of you that work with them know. We have 36 socially conscious business partners, and these are firms like 501c, like the Schuster Group, who have specifically blended the way they approach business to help nonprofits. We vet them. We turn down more of these business partners than we accept. And we have built a great community to support the sector through sort of our business endeavors. Membership is free. We welcome any and all nonprofits to join us, regardless of size. It's free because it's been funded by our business partners, so the nonprofit sector does not have to fund it. We have three primary missions. One is professional services on a preferred basis. I'll be talking a little bit about that as we go through the presentation. Education and training, we'll do over 40 to 50 trainings this year. Many of them are live workshops and some are webinars. With me is Rob Bloomstone, our Director of Marketing, and he does a great job coordinating all of these events and helping expand our footprint throughout the country. We also have mission support, and this is where we rally our corporate partners to help support the sector, more so in a financial way. We do some volunteer work out in our communities, but we've created a foundation, and we have what we call the Rising Star Scholarship Award. We give a handful of scholarships each and every year to what we consider rising stars within the nonprofit sector. And they tend to be employees who have demonstrated a passion for working in the sector and a level of growth and improvement within the sector, yet they need training. And we attach some funds to those folks that are nominated by their nonprofit employers and help get them leadership training or finish their bachelor's degree or whatever it might be, so that that person can be more impactful as they go to work within your nonprofit. So if any of you have any rising stars, I ask you to consider looking at TANGO. We want to give these dollars out each and every year, and it's just great to see the success we've had in attaching some dollars to these folks. So that, in a nutshell, that's what's going on with TANGO. So the future of nonprofit benefits in the nonprofit sector. Let's talk a little bit about what we're seeing out there. I've been doing this a long time, and the amount of change that we're seeing in this space is unprecedented, both from an employer perspective as well as an employee perspective. There's really a convergence of what we like to call health and wealth. So many decisions at the employer base are made on a siloed basis, and we're starting to see a real breakdown in those silos as healthcare becomes more complex, as retirement plans become more complex, as the workforce changes. And we're seeing progressive employers really adopt a holistic approach to providing benefits and solutions to their workforce. And a lot of it is governed under sort of that concept of total compensation. every organization has a bucket of money to spend on salaries and benefits, and how you allocate that is changing a lot as we move into sort of this next generation of what I think are sort of the new wave of employee benefits. I'm sure some of you have workforces that are made up of all four generations: baby boomers, Gen X, Gen Y, which are the millennials, and Generation Z. I know we do here, and they are different, and it does present some challenges. They have different priorities. They view work differently, and they view accessing benefits differently. So from an employer perspective, how, as a nonprofit, can you engage with your staff to really create impact and help with things like retention and recruitment? And no longer does one size fit all anymore. And we've moved into an age, I think, of high touch and high tech, because it's really the only way to access these generations. I am at the tail end of that baby boomer realm, and then you have Generation Zs who have grown up in a digital world. They had an iPad before they probably had a printed book. So it's an interesting workforce right now. One of the reports that Mac mentioned that we look forward to every year is the Metlife Annual Employee Benefit Trend Study. It's a really very much well done research document. And again, we'd be happy to send it out to anybody that's interested. And you can see the title this year is Thriving in the New Work-Life World. As we look at our own workforce and the workforce of the clients that we work with, it's really important to touch base on work life. It is front and center. The new generation wants to balance work and life, much more so than I think we've seen in the past. And their lead-in statement is, in the changing world of work, one thing remains constant. For organizations to thrive, employees must thrive too. So progressive employers are adopting this philosophy. And I know for myself, it's a similar philosophy that I've followed over 40 or over 30 years. It's kind of along the lines of happy wife, happy life. So if you take care of those people that are important to you, they tend to take care of you too. So, this is definitely a theme throughout this report. This year's top insights were when employees are supported as individuals, they're more engaged. The key word there, individuals. So how in a relatively large organization can you customize benefits down to an individual? That historically can be a challenge. But there's some new strategies that we'll talk about that really get down to the individualization of benefit elections. Finding purpose at work, that's really important. I know a lot of the newer hires we've had here at the Schuster Group have come here because of our work with TANGO. It's a way to give back to the nonprofit sector and engage in the sector beyond what we do all day long in the world of insurance. And most of you run nonprofits that I'm sure your folks are passionate about. So, that purpose concept is readily available, I would think, front and center in your workforce. Technology, clearly a driving force today. Flexible careers, that is something that we hear about from our staff and the staff of our clients constantly. More flexibility. And this whole gig economy, the economy has been pretty good lately. It is imposing a challenge for a lot of the nonprofits we work with from a retention and recruitment standpoint, especially at the lower end of the income spectrum. And, if you look at a lot of the great work you guys do, whether it's healthcare or human services, it's not easy work. And some of these folks can easily drive for Uber or Lyft and get paid a fair amount of money without really some of the struggles and the work. So benefits become a really important play in this new world. The gig economy does not provide benefits, at least yet. So one of the ways to really retain and recruit employees is to have a focal point on your benefits. So how are progressive employers really driving these kind of results? First and foremost, they're managing costs. That's not the easiest thing, but there's an an intentional focus on managing costs, especially on the healthcare front. And we're seeing an explosion in employee choice, a look at non-traditional financing of healthcare, along with innovative plan design, and this concept of aggregation, making yourself bigger than one nonprofit agency as you go to market. So those are three trends that we'll talk about as we go through the presentation. On the retirement side or the wealth side, we see a lot of focus here, and there's been a lot of articles written in CFO-type journals about retirement readiness. And is your workforce prepared or on the path to being prepared to retire on their own terms when they're before they start to see productivity fall? Targeted education, plan design initiatives. Those are the things that we're really seeing front and center as we look at progressive employers. So why are we really focusing on all this? So much of this has to do with cost, especially as it relates to healthcare. Here's a chart from 1999 to this year, 20 years of the escalation in premiums on a national basis. This is a report from the Kaiser Family Foundation. They do it each and every year. Another great report. Be happy to send this out to you. But it's becoming unsustainable. You know, a family today can easily pay over $20,000 a year. Yesterday, I had the pleasure to meet a nonprofit. They had a $30 copay and a $3,000 hospital deductible. Their renewal rate for a family was about $38,000. I mean, that's really hard to deal with in this day and age. So a lot of focus is being spent on managing the costs. This is not just an employer issue. There's been a massive effect on employees. This is another chart from the Kaiser Family Foundation, and it just shows inflation and earnings outpacing inflation by a little bit. But premiums have grown almost double of what earnings have. And then deductibles have gone off the chart. So cost sharing that employees are having to bear are much higher today than they've ever been in the past. So what do you do about this? The traditional approach to manage your healthcare spend. You know, I'm sure many of you that are listening have gone through this, if not recently, at least in the last few years, probably enacted several of these strategies. So changing carriers, raising copays, deductibles, charging employees more for their coverage, creating incentives to remove spouses and dependents, initiating wellness programs with sometimes questionable return on investment. You know, is all of this working? Well, yeah, it is working, but we're running out of rope. You know, how often can you change carriers? How high can you go on deductibles? How much can you charge employees? You know, there's a point at which you start to lose the effectiveness of providing benefits, to the point that are your people benefiting from having benefits? So progressive employers are really starting to think differently, outside the box, to manage this. One of the approaches that we've had quite a bit of success with is defined contribution and private exchange. So TANGO has a private exchange. We've got a couple of proprietary carriers in this. Those of you that aren't in New England, we'd be happy to consult with you on how to craft this. It can be done anywhere in the country, and has really been a shift in mindset. So in this environment, an employer basically was saying, listen, I am done with chasing premiums. I cannot do this. We've historically attached our contributions to a percentage of premium. We're gonna cast that away. We cannot do that. We are going to define a contribution, and think of it as creating a bucket of money. Some employers have it solely for healthcare and provide employer-sponsored benefits for ancillary benefits, such as life, dental, disability. Others have two buckets, and it's a fixed dollar amount. And those employees then shop for benefits on a platform, a technology-based platform that you would deploy. And you might have 4 to 10 health plan offerings, ranging from copay plans to very high deductible plans. You might have a couple vision programs, a dental or two plan, accident coverage, disability, telemedicine, even pet care. And the whole concept here is really I want to get out of the game of picking what's best for my employees and empowering them to choose a benefit plan or build a benefit plan that is really appropriate for their own needs. So you're kind of shifting the paradigm to, instead of that oftentimes painful renewal cycle where you're tinkering with benefits to hit a budget line item, you're basically building a platform and allowing employees to direct where they want those dollars to go. We've had a lot of success with this strategy. Employees like it. Now, it's not rolled out without a little bit of effort. There's more education involved, more hand-holding. We often roll out programs like this with a bunch of tablets and counselors so people can sit with them and help them make appropriate decisions for their needs. But the outcomes of this are highly engaging, and we see appreciation measurements rise significantly. We pulled a report of just a recent client that went through this, and I just wanted to share with you just a couple of the results. So in this example, the employer continued to provide short and long-term disability and base life insurance up to $50,000. They had 8 health plan offerings and a multitude of other programs on a platform that people could go on to electronically and compare benefits and point and click and basically fill a shopping bucket worth of benefits and spend down that bucket of money. So that first example, that 28-year-old single social worker, her needs are radically different than the next person, 20-year-old manager with family, and different than that 60-year-old, 63-year-old maintenance worker. So we're not trying to have 1 or 2 or 3 plans fit the needs of all. We're shifting the dynamic and allowing them to build programs that fit their needs. So the benefit elections from that 28-year-old woman, she went with a high deductible health plan, single coverage, put a little bit into an HSA, bought accident coverage. She's quite healthy, but she wanted to hedge her bet in the event she was hurt skiing or doing something on the weekend. The dollars would be created to cover that deductible. She's up to her ears in student loans. So she's participating in a student loan program, and there's been an emergence of some technology-based companies that are making it very easy for employers to provide this benefit, and we're seeing a real uptake. We've been using and have a couple special deals with a company called Peanut Butter and another one called Future Fuel. We think they're really, really great companies. They can structure refinancing programs. They can coordinate with an employer that wants to make a contribution. There's even been a private letter ruling from a handful of employers allowing employees to waive their contribution to their 403B plan, but participate in paying back their loan, student loan, and that qualifies for the employer match into their retirement plan. So we're starting to see an emergence of that, a hot issue for certain people that have student loans, and a very much an appreciated benefit. 403B, she's putting the contribution up to the match. Telemedicine, we see a lot of our clients adopting telemedicine. We like it where there's a $0 copay, so there's no financial barrier to access care. And those of you who have not had any exposure to telemedicine, it's wonderful. You pick up the phone or you email somebody within minutes, you get a call back from a doctor in your state. They go through your problems, and they can prescribe medication if needed. Really positive customer feedback on those programs. Genetic testing is another kind of new benefit that we're seeing with some pretty good uptake. And, this is sort of a new wave of wellness. Personalized prevention, where you're looking at genes and really helping people determine whether or not they're at risk. So we've been using a company called Color Genomics. They're kind of on the forefront. The price point for those type of services have come way down. And they screen for 30 genes for hereditary cancer, 30 genes for heart health, and medication management. The whole concept here is if I am predisposed for a certain type of cancer, I want to know early. and I want to be able to talk to my physician about it and maybe have the routine checkups that are sort of follow the masses. I want to be checked more frequently. And with knowledge is power, and this avails people to some predisposition genomically if you fit that mold. So she was interested in that, and then she happens to have a dog, so she bought pet care. That 40-year-old manager took a little different approach. So he went with a copay-based plan. He did not include his spouse because this employer has a spousal surcharge. So if your spouse works at another employer, yet you choose our coverage, you're going to pay more. If there is no coverage option for them at their place of employment, they'll come in at a lower rate. But we don't want to be the company there, the nonprofit that wins a beauty contest on health plans, nor do we want to subsidize the employer down the street. So if you have an offering there, take it. They did an FSA. They participated in a 529 college savings plan. So pre-tax growth of your retirement savings for their kids. Financial planning was a pretty hot topic at this employer. So making sure this employee is prepared and on track to accumulate enough money to retire on their terms. And a couple other benefits you can read through there. That 63-year-old maintenance man, high deductible health plan, maxing out their HSA, maxing out their 403B, but focused education on both financial pre-retirement planning. Do you have enough money to retirement? What's it going to look like when I turn on that income faucet? And Medicare planning. We do a lot of Medicare planning here with really good feedback. It's highly intimidating leaving the workforce after 40 years and wondering where your insurance is going to come from and do I have enough to retire. When people go through these type of educations, they are more apt to pull the trigger and retire, which is good for them and good for the employer. So in all these scenarios, this employer spent the same amount of money on each and every employee, but the outcomes were radically different. And the engagement was significantly more. So this concept of defined contribution, private exchange, we're seeing really, really grow.
Hey, Rollin, before you move on, there's a couple of questions about the defined contribution plan setup.
Yeah. Okay. Is a defined amount, I see it, a percentage of salary. Typically, it's a flat dollar amount. Sometimes we have structured with employers multiple buckets based on tiers of income. But it's oftentimes not necessarily a percentage of salary. It could be, though. There's a lot of flexibility here. I think the closest we've had an employer go towards that is lower paid people got an actual higher contribution towards their benefit structure than did middle management and senior management. So it's sort of a way to level the playing field a little bit. But yes, you can get highly creative with respect to how you fund that defined contribution. Thank you, Mac, for pointing that out. I hope that answered that question. The next page just gets back into the Metlife report, and this is from this year's report. What do employees consider must-have benefits? To me, there was no major surprise here, and I just wanted to include this in the documents for you folks, just to look at what a lot of leading employers are offering from a breadth of benefits and how employees feel about them. I guess the one surprise I had on here was towards the left side column lower, defined benefit pension plans. I think everybody would like one of those. Not many people offer them. What's interesting about this report, if you would like it, I'll email it to you. It's somewhat interactive too. So you can put in your size of organization in your region, and it'll take the multitude of results and slice and dice it for that too. So another question. What was the name of the genetic testing company? It was called Color Genomics. And we have some preferred pricing at TANGO. It's a pass-through. We honestly don't make any money on it. but with our clout and 160,000 people that work in the nonprofit sector, they gave us some preferred pricing for color. If you'd like us to send you the brochure or make that connection, we'd be happy to do so. How large of an organization do you need for a program like this? Defined contribution, there really is no size limitations on it. Sometimes, depending on the region, the carrier, the health insurance carrier, will have limitations on how many plans are offered at once. So, I think our largest plan spectrum has 10 health plans. Oftentimes, in the smaller end of the market, a Blue Cross might say, okay, you can offer 3 plans together or 4 plans together, which accomplishes the same thing, just not to the degree that some employers have. I'm not a big fan, quite honestly, of a 10 health plan platform. That almost becomes overkill. We see a sweet spot of I'd say 4 to 8 is kind of a nice array. You can pretty much hit everybody's needs and a price point along that spectrum for everybody. This next report is from one more slide, please. There we go. Are some emerging benefits that employees found very interested, and 72% wanted unlimited paid time off. Now, that sounds great, but we don't have unlimited paid time off here at our office, and I don't think we could. Some of these cutting-edge tech companies have it out there. Some it's worked, some it has not worked, but man, it sounds pretty nice, right? I have unlimited paid time off. But everybody has to get their job done. So it's not shocking to see an employee population really want that. The reality of how do you manage that? I don't know. That's a house of cards in some regards. It's a wonderful gesture and a great thing to do if it works for your workforce. Paid sabbatical time, another kind of hot issue. This whole concept of flex time, paid time off, time to focus on a project or an educational advancement program or something along those lines are becoming more and more sort of a topic of discussion these days, especially with that newer generation. We're seeing a fair amount of uptake in concierge type programs where you're making it easy for employees to interact with either healthcare or retirement issues. And we'll go into that towards the end of this. And then genetic testing is emerging, and every year we see this report, genetic testing continues to rise in its popularity. So those are some of the things that is front and kind of emerging. As we look at the variety of progressive benefit offerings, outside of what we've just talked about with student loans, which is super hot, genetic testing, which is really hot, time off, which is hot, are things like telemedicine, low cost, high impact, health advocacy and concierge, pet care. We're seeing more and more interest in pet care of all things. Personal financial planning, we have a lot of uptake there, and we've crafted our firm to really start to deliver this in a multitude of ways with a health and wealth concept behind it. College savings, identity theft. The last two, I just want to comment briefly on this. Transportation and elder care. We're having a lot of discussions with some progressive employers about the social determinants of health. And you look at a workforce, and quite frankly, there are some significant barriers to a lot of direct care employees. And I think many of you probably have those type of employees. And it can be simple things like the deductible and the financial barriers that are there to kind of put a roadblock up on accessing care. So we're seeing a movement towards free primary care, or at least a handful of sessions that provide free primary care, not for wellness because legislatively that's 100%, but free primary care. Transportation, getting people to the doctor if they need to. Elder care, child care resources, those kind of things, helping people that might have 2 jobs, sometimes even 3 jobs, manage healthcare so they're taking care of themselves and their family's needs. fact, we're working on a project with a large nonprofit and a group. We're putting together a pilot group to really, really address this in a New England region, and I'll be able to report on that as we get further into it. So, again, that's a couple areas that I wanted to touch on. I do want to run through financing healthcare fairly quickly. We're seeing a lot of talk and focus on trying to bend the healthcare cost curve. So many nonprofits are fully insured. That's typically good for any size group. I would say up to 200 to 300 employees. At that point, you're going to want to start to look at some of these other alternative funding arrangements. Fully insured is good. It can have transparency, typically no transparency under 100 employees. Transparency is claim data, where you can actually make informed decisions about what's going on within your workforce. They're packaged. Here's your premium. There's no risk. Moving down the spectrum are all self-funded or partially self-funded type programs. And self-funding is made up of three components: administration costs, so the carrier or third-party administrator to run the plan, the network, insurance, stop loss. Self-funding sounds scary, but there's always insurance involved too. And you set how much risk you want to take through stop loss insurance. And then claims. You're paying claims yourself. There's level funded, which bundles it all and makes it look like fully insured. So you pay a fixed premium. If you run better than expected, you get a dividend back. So it's kind of a participating contract. Captive, which I'll go through in a moment, is this concept of aggregation or pooling risk with other employers to smooth out the ups and downs of traditional self-funding, and leveraging collective buying to lower margins within insurance carriers. And then self-funding for larger organizations can work very, very well. Traditionally, what we see in self-funding, you'll typically save 7 to 12% just out of the get-go by going fully insured to self-funding. And a lot of it's driven through taxes and fees, and a lot of it's driven through the risk margin that carriers put in to a fully insured rate development. So something that if you're not considering it, we're seeing a huge movement towards some type of self-funding. Level funding typically is good for 5 to 100 employees, captives 50 to 400 employees, self-funding 200 plus. Let's just talk a little bit about this level funding program. I pulled this Aetna grid for two reasons. One, it's a nice layout. It just talks simplistically about how this whole thing works. So customer pays one fixed amount each month, just like you might be doing with fully insured. There's no extended liability beyond that if you terminate coverage. Medical costs are paid out of those reserves. And if there's a surplus, if you run better than what sort of that worst case scenario is, they share in those results, that claim fund. So we're seeing a lot of our clients get what we often call dividend checks. They've run better than sort of expected, and they get a dividend check. When you look at a fully insured carrier, historically they'll win 4 out of 5 years. You're going to have a catastrophic type healthcare claim year once every 5 years. That doesn't hold true for everyone. It is volatility there for sure. And that's why insurance carriers like fully insured business, and it's quite profitable because they're taking the risk, but they win 80% of the time. This particular product, as many of you probably know, CVS, the drugstore, bought Aetna. So now they're adopting the 2 platforms, so you can get no-cost minute clinic visits at CVS. They've written Apple's business, and as such, they've partnered with them on a lot of their wellness technology. It's an underwritten product, so there is a look at the group, and it's done 2 ways. At the small end of the market, typically under 25 employees, there's a health questionnaire that can be done online. Above that, it's what's called GRX, where they look at prescription data that is out there readily available with authorization from the employer, not by employee name, but as an aggregate data point to see what type of meds people might be on, which is an indication of their health. And then they come up with a rate. More times than not, we're seeing these very competitive where it fits. So we're seeing 20 to 25% rollbacks where the group is somewhat healthy, and it certainly doesn't fit everybody. But I do want to point out that TANGO recently cut a deal with Aetna, and it's broker friendly. So any broker in the country can access this discount through us. You have to be a TANGO member, which is free, and you receive a 2% proprietary discount, which equates to about $14 per employee per month. There's also right now through the end of this year, and we'll probably reinstate it again for July 1 effective dates because we know that's quite popular for nonprofits, is $100 per enrollment premium credit. So if you have 20 employees, that's $2,000 off your first bill. And again, we crafted this so any broker anywhere in the country has access to it if the member is a TANGO member. There's no fee reduction for their compensation, but we wanted to expand this around the country. So the broker, the regional rep might know about the TANGO arrangement, have them contact us, and we'll set them up, and you can take a look at it if it's of interest. Let me talk about captive for a moment. So 98% of all employers with 1,000 or more employees self-fund. The scary part for the middle market, 20 to 1,000 employees, is the volatility. They like the potential savings, but the volatility, especially in a nonprofit where many of you are funded by state contracts and what have you, where there's the volatility is not a good thing. Captives provide a pooling mechanism that really provides smoothing of claims and renewals over the years. This is a quick snapshot of one of our clients that participate in our captive. Has 88 covered employees, so not a huge employer. This is kind of real-world example. They were experiencing 12% increases, fully insured trend. The captive came in. We reduced their premiums pretty significantly, and then we've had about a 2.5% uptick after that. Really progressive impact on bending that cost curve for this client. Let me talk quickly about self-funding. So self-funding is where you pick how much risk you want to take. And in this box, you'll see that dark blue. That's risk-taking. So that would be something that this particular nonprofit employer said, I'm okay paying out of cash flow the first $50,000 of claims per individual I have. It's called specific stop loss. I also want to have what's called aggregate stop loss. So if I have a lot of my employees have a lot of claims, I want to have a worst case scenario, and that's covered under aggregate stop loss. So that's kind of your worst case. You know going in what your worst case is. You have an expected target amount that often is less than fully insured. And if you run better than expected, it's all savings. The risk shifting is your reinsurance costs. So this is where insurance comes into play, stop loss insurance. And it's an entirely different market than what we might know in the fully insured market. They're not necessarily household names like United Healthcare and Blue Cross Blue Shield and Aetna and Cigna. They're specialty companies, and the market is big to provide stop loss. Everything's held together through a TPA or a carrier. So claims are paid as they normally are to an employee. They don't see anything different. It's all about how you finance your claims. What happens in a captive is we're starting to add another layer in here. So you'll see that middle layer of risk sharing. This is where employers are pooling. So we're buying less insurance, we're pooling, we're seeding that risk layer with dollars, and if we run well, those dollars come back to the participants of the captive. So you're setting your risk exposure, just like the prior example, at $50,000, but you're seeding, instead of premium to an insurance carrier, 2/3 of your premium is going into a captive, 1/3 is going into an insurance policy, but at a much higher level. And if you win, those dollars come back. So here what we're seeing is squeezing the margin out of the insurance carriers and turning the table towards the participants of the captive, i.e. the employer. It also lowers volatility. So in a year that you might deserve a 10% rollback in premiums, you might get a 0 increase. Everybody's rated individually still. But in a year where you deserve a 30% increase, you might get a 15. kind of thing. So because of the smoothing effect that takes place in that risk-sharing layer. Financing healthcare. So those are just the fundamentals of financing healthcare. Here's a couple other things we're seeing. A lot of it is governed under what's called a move to value. In fact, in Connecticut, there's an initiative called Move to Value that the state of Connecticut is generating. Two of our staff are on the leadership team of that initiative, and it's really a move towards creating incentives for people to access appropriate care at an appropriate cost. And it is made up of advisors like us, physicians, and large employers. And there's a lot of interesting dialogue going on that front. Some of it has to do with steerage. So I don't know if any of you folks out there have heard of centers of excellence, but it's where you can access care for certain types of ailments with tremendous outcomes, but much lower costs. So Cleveland Clinic is a great example. For cardiac care, they're a center of excellence. They have the best outcomes on the planet, but they have some of the lowest cost structure as well. So within a plan design, you can say, you know what, if you go to Cleveland Clinic, we're going to waive the deductible. You can go anywhere you want, but we'll waive your deductible if you go to Cleveland Clinic and get care, because we know the outcomes are going to be best and our negotiated cost structure is going to be less. So it's good for the patient, it's good for the employer, but you're not forcing the hand. They can go to any physician they want to. You're incenting them through benefit steerage. That picture on the far left is called Health City. They're in the Cayman Islands. I don't know if anybody's heard of that, but if not, check it out. It's kind of an interesting story. It's one of the best healthcare facilities in the world at a fraction of the cost what care is given here in the United States. So they're playing into a high-end medical tourism play with a lot of success. Their outcomes are tremendous. They happen to be next door to the Westin. So you can fly. We have some employers looking at creating incentives where you can, if you need your knee redone, fly down there, get it redone for half the cost, put your family up at the Westin next door, take the week off following surgery, hang out on the beach at the Westin, come back. The whole incident has been covered significantly less than going to your local hospital. That kind of stuff is starting to emerge. Tiered networks, direct contracting, bundling, finding provider groups that are best in class, but also negotiating a better rate with them than the carrier might have. We're underway with a large healthcare group here in Connecticut in that exact setting, and we're going to be offering it to our captive group. Reference-based pricing, that's an initiative where it's not wrought without issues, but it's a tactic where you're paying a percentage of Medicare. So most insurance carriers pay 200 to 300% of Medicare. In a reference-based pricing, you say we're going to pay 120% of Medicare, take it or leave it kind of thing. And it gets into some balanced billing issues, but it can drive savings. It does not work in every pocket of the country, though. New England is seeing it with mixed success. Data-driven decisions is big. Before I get into the pharmacy thing, I don't know if any of you guys have looked in the Wall Street Journal over the last 2 days, but Google had a project with Ascension Healthcare. It's a large healthcare hospital system, coded Project Nightingale. And somebody leaked it, and now, just in today's Wall Street Journal, Google Health deal draws scrutiny. Federal regulators are opening an inquiry into Google's Project Nightingale. So what they're doing is they're collecting data and putting it in the clouds and looking at large populations and trying to make sense of how technology and artificial intelligence can help providers deliver better care. But there's also the security side of it, right? What are you doing with my healthcare data? So we're going to see more and more of this in the press. It's kind of an interesting story if you're a healthcare geek like me to follow. So just keep your eyes open for discussions on Nightingale. Another thing that's been in the mail or in the news lately a lot is financing healthcare. So we've all heard about the monkey business these pharmaceuticals have given, and most of them are from PBMs, pharmacy benefit managers. It's not so much the manufacturers oftentimes. The manufacturers sell these drugs to distributors called PBMs. They work with self-funded players, and you can carve out your pharmacy structure. So one of the reasons this is happening is because if you look at a PBM, there's 47 ways a pharmacy benefit manager can make money on one medication. Kind of the Wild West. Now that's starting to change, but we're seeing a lot of movement in this space. For every $100,000 you're paying to your PBM, you're probably overpaying by $30,000, i.e. 30% savings are readily available. We had one small group, about 50 employees, an independent school, nonprofit independent school. Half of their healthcare spend was in pharmacy. We put them with a progressive PBM, and we're seeing their healthcare or their pharmacy spend lower by about 40% trending so far this year. If you're looking for a good PBM, these are some of the attributes you want. Pass-through pricing and rebates. The rebates should be going to the employer, not the PBM, not the insurance carrier, back to you. Set administrative fees. Getting paid one way, flat fee. Having pharmacists on staff for protocol and clinical utilization. And then there's some consortium programs. We had one incident where we had a group with CVS Direct. We moved them to CVS within a consortium. Same exact formulary, same exact carrier, no disruption to the employees. That's trending at about a 40% savings as well. It's just kind of crazy stuff. Let me finish up by running through the wealth issues too, because a lot of the focus has been on healthcare. Wealth is another important issue. So the Metlife report said the number one source of stress is personal finances. Not often talked about in employee ranks because it's very much a private discussion. These are some of the top 5 sources for financial stress. It's looking at retirement. Can I retire? Outliving my savings. A lot of it kind of crosses over into that healthcare side of things. But that's what people are worried about. This is a chart that jumps off the page at me. I expect to postpone my retirement due to my financial situation. That is increasing. We've been in a very, very good economy with a bull market for over a decade now. Yet we're seeing more and more people postpone their retirement, not because they like work, but because of the nervousness around their financial situation. This is reminiscent of what happened in 2008 after the financial collapse, where we saw people staying into the workforce much longer than they should have. What comes with that? As we age, increased healthcare costs, workers' compensation costs increase, productivity decreases. This is where we think it's critically important for an employer to make sure they're paying attention to the effectiveness of their retirement plan. Are your employees ready to retire on their terms when it comes time for them to retire? Things like plan design, auto-enroll, auto-escalation, stretch match. Don't do a flat 4%. Do 50% of 8. It encourages people to go to 8%. It's the same allocation if they do. Fiduciary roles. Make sure you're looking at your fee structure in your retirement plan so more money is left in the participants' hands. Are you monitoring that obligation? That's a whole nother seminar. Looking at fiduciary roles and responsibilities. But I think the magic happens through education. One-on-one, targeted, age-based education. We like to provide health and wealth education. So you're looking at healthcare issues, especially as someone's getting close to Medicare availability and wealth issues. So putting all this stuff together, a lot of cost containment, a lot of interesting concepts. It complicates the decisions for these employees. So how do you engage with them? How do you leverage technology? Certainly the vast majority of our groups now are on online enrollment. Concierge services, mobile apps. So managing costs, engaging employees, and providing a choice gets complex. What are some of the progressive employers doing? So just kind of a fun slide. This is Christmas Eve at the Vatican, 2010. This was last year. What do you know? A lot more technology in the crowd, right? The average person checks his or her smartphone 47 times a day. 8 trillion texts were sent last year. 98% were read in 2 minutes. How many of you are communicating with your employees via text? It's front and center. Everyone, regardless of their income, for the most part, has a smartphone today. We've partnered with a firm called HealthJoy, and we're bringing technologies to the whole technology solutions to this whole space to simplify healthcare and benefits. So in this case, everything's put onto a phone. Your benefit design, your ID cards, the ability to shop for prescriptions through GoodRx. All of your benefits are incorporated in this app. Telemedicine, you can talk to a doctor with zero copay with a click of your phone. There's a chat window using artificial intelligence. I've bought this for all of our staff, and I used it. My primary care doc retired. I wanted to find a new one, so I went to Joy and asked her I texted her for, hey, who's a good primary care doc in my area? She gave me 3 suggestions. Never talked to a live body. It was all done through artificial intelligence, and they booked the appointment for me. Drug savings. GoodRx is attached to this. Your ID cards are here. You can book an appointment. If a bill has gone astray, you can have concierge services here with the point and click of a button. All embedded on a smartphone, highly impactful, highly engaging, and highly appreciated by staff. So that's what we're seeing out there. And I just threw a lot at you guys. I apologize. From health and wealth to financing healthcare to employee engagement to technology. But I wanted to leave a couple minutes for any questions or any dialogue that anybody might have. Be happy to support those. We have one. Are there any discrimination rules by tying percentage of, I'm assuming, employer healthcare contribution or the bucket concept to salaries? There's no discrimination rules as long as you're doing it by class. So I certainly would shy away from supporting senior management at a higher level than rank and file. There's something called discrimination testing in your Section 125 plan. There's a 105 test for fully insured programs that come into play. So you do want to do that with some thought and not trying to reward the chiefs without rewarding the Indians. How do we get a copy? I'm sorry. How do I request the thriving in the book? You can send me an email and we'll get you that document. There is my contact information. Be happy to send anything you guys need. Fixed budget. Any other questions? How's a large organization? Okay, we talked about that one.
Yeah, we got it.
Okay, great. Well, it's just about an hour on the button. Thank you all for participating. Mac, thank you for spearheading this. I hope people found it of interest. If you'd like anything from us, we're happy to help. And continue on doing the great work you guys do in your communities. Thanks for being a part of today's discussion.
Absolutely. Thanks, everybody, for coming. Thanks, Rollin.
Thanks, Mac.